I will just run through the physical causes of
Okay.
erectile dysfunction. Any organ damage, for instance, heart conditions, any heart condition, okay, atherosclerosis, that is excessive fat in the blood vessels,
Hmm.
or fat deposit in tissues, high blood pressure, hypertension, diabetes, obesity, any form of metabolic syndrome, multiple sclerosis, Parkinson's disease, smoking, tobacco use. Okay, then when some people do circumcision, some actually are not properly done. There is a scarring at the penis, at the glands of the penis. It is called Peyronie's disease. So with that, it can also cause some form of pain, and as a result of the scarring, cause erectile dysfunction. Apart from smoking, alcohol is another crazy person or crazy entity nearby that will eventually cause erectile dysfunction. Then, some people who are on treatment for all forms of prostate ailments, especially prostate cancer or benign prostatic hyperplasia, this can also cause erectile dysfunction. Then any form of surgery that is done around the pelvis, some people can decide to do a vasectomy, that can cause erectile dysfunction.
A
And anything
vasectomy
that
too.
causes vasectomy, yes, yes.
Wow.
Yes, yes. So, and then anybody that has any issue, that a condition that causes low testosterone, altogether, this will cause erectile dysfunction. And apart from the physical conditions I just mentioned, the first thing I mentioned is the psychological aspect, which is equally as important, talking about depression, anxiety, stress. Some people they do a lot of stressful work, sit from morning till night, calculations, balancing figures, and then when they go to sleep in their dream, they are still punching calculators and balancing figures. How will you do now? Your body is stressed out, and then madam comes and says, oh yeah, and the thing stands. After 1 minute, it goes down. And you keep asking, and then you go to drink, power drink, energy drink, and all those drinks. You are just damaging what is not spoiled. You are damaging an organ that has no malfunction. All you need to do is reduce your stress, not to go and be drinking power drink and all that. Okay? Any relationship problem due to poor communication, all concerns, all emotional problems can cause erectile dysfunction for a man, and that is for a
Doctor who was on a radio program like this said
okay.
men should involve or indulge in sexual activities at least 21 times in a month to avoid coming down with prostate cancer.
issues.
Right. And
My brother.
it's somewhat related to what we're discussing right now because, of course, if you don't want to have erectile dysfunction, you don't want to have prostate cancer, right? So, in your justification, would you say what the doctor said, 21 times in a month,
It's
is
close
a
to it,
fair
sir.
deal? It's close to
It's
it.
close to
It's
it.
not too
It's close
much.
to it. No, it's not. If you can have sex every day, please have it. Oh, if you are certified to have it. Yeah. If you are certified to have it, please have it. But really, you need as much as that to keep yourself from prostate issues. Yes.
Fair enough. So, you said something. If you are eligible to have it, you can go ahead and have it. Erectile dysfunction as well. How true is this?
Very,
Because
very
the
true.
excuse is, oh, because I cannot indulge in sex, how about I try masturbation?
Masturbation is destructive because it can cause a mental issue. I mean, can you imagine the worst thing that can happen to a man is when you are with a woman and then you feel like you prefer it just to happen all by yourself. I mean, that would disturb, that would damage. That man cannot achieve any successful relationship with any woman because the woman will just get up and walk away and never look back. Yeah, becoming an issue. Next thing, the woman, I just learned after some months that she picked her things and ran away. So, yeah, so it's destructive. I mean, erectile dysfunction is destructive, and masturbation is never an option. It is never an option and should never be practiced. If you know anyone doing it, that person needs a lot of psychological help. Let the person seek the doctors.
So, doctors can advise you from it. I mean, I'm
And of
just
course, they
curious. I
can.
want to know. Doctors can,
Yes, doctors
advise
can.
you. Okay.
Yes, doctors will advise against it.
It's a revelation as we speak on erectile dysfunction this morning. Well, if you have questions, please do well to send it to 0904 this morning. I'll be looking forward to hearing from you. Otherwise, you can also call into the studio. The numbers are 0909 888 9939 or 0912 222 2939. I'll be back.
Betu, a public health physician. This is my reminder to you to stay safe, keep your homes clean and pest-free. Also remember to wash your hands regularly, and if you feel ill or any of your family members, please remember to see a healthcare provider first. Keep listening to Solutions Clinic.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweats. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9.
All right, welcome back. You're still listening to the Remedy Dial Solutions 93.9 FM. Doc, thank you for joining us once again. Hello?
Yes, I'm here. I'm right here.
Okay, thank you so much for being here. All right, I think you were saying something before we got interrupted by the network.
Yes, we were saying that the doctor will now, apart from counseling about masturbation, he will make every necessary diagnosis, because some people find themselves doing this for a psychological reason. So whatever diagnosis needs to be made will be made, and then the proper treatment will be channeled towards it. The goal is to treat all that concerns the masturbation and take care of it and take it out completely. Yes.
That makes sense. Is erectile dysfunction peculiar to any age grade, or it can just happen to anybody?
It can happen to anybody. Like we said, the factors we mentioned here cuts across both young and the old. Now, the heart disease will happen in the old. Okay. Now, the hypertension, diabetes happens with age. But of course, stress, alcohol, tobacco usage can be found in the young. Substance abuse can be found in the young. Sleep disorders, which I didn't mention, can be found also in the young. Surgeries or injuries to the pelvic area can also be found in the young. So what are we trying to say? All these things can happen whether young or old. So erectile dysfunction can happen in every age group, any kind of age group, irrespective of the age per se.
All right. I think that one of the most concerning questions for most men, dealing with erectile dysfunction is, how do we go about the treatment? Especially with the popular phrase on social media, 1 minute man. You see that a lot of influencers are posting, like you mentioned, different drugs or herbal products to take, to boost your sexual ability. What is the actual way to go about, especially for the said 1 minute men who, as a result of anxiety and stress, will just, ejaculate in that 1 minute?
Now, you see, before we talk about this solution to it, all this, but while you are doing it, offer solutions to all this. But while you are doing it, offer solutions towards the erectile issues that the patient is having. And that is what it means to optimize your patient maximally. You know that this person needs to treat that prostate issue so that you can prolong the life of the life of this person. While you are treating and optimizing the prostate issue, you also have to optimize the relationship life of this person. It is one thing to stay alive, it's another to be alive and be happy. It's another thing to be happy with your partner. So you have to do what is called systems thinking, holistic approach, manage the whole life. For those who are smoking, stop smoking or limit avoid alcohol or you stop it. Don't do illegal drugs. Those things are non-negotiable. Then exercise regularly. Exercise regularly. Okay? Go for counseling on those emotional stress, mental stress, depression, and co. Once you do this, you will. You'll find solutions to it. Now, for those who are having issues achieving erection, there are medications doctors can prescribe. I've seen a lot of my patients who do come down and say, doctor, one more thing. You see, thank you, I feel better now. In fact, my blood sugar level is under control. My BP is under control. But there's one more thing, that man, they get up, what do we do about it? I would say, no problem, Baba, no problem. Come on a day and then come alone. And when they come, I do see them, counsel them. Then I give them prescriptions to use. And with that, they will tell me, doctor, thank you. You are, I'm back now, I'm back. Thank you. No, that's a lot of fulfillment.
Absolutely.
And they tell you, I'm back now. Thank you. So that is it. So if you're involved in smoking as a young man, you're involved in hard drugs, colos and co, all those stuff, you are playing with erectile dysfunction. Please do away with them. Smoking, illegal drugs, alcoholism, and all that, they can affect. You may think that they are not affecting you now.
I was getting there because you will hear conversations like, these things empower me. They give me the ginger that I need to perform.
Wait. That's why I say wait now. How old are you now? 24, 25, 26. They empower you now. Remember, you will be 31. You will be 34. Imagine by then you are married and then you turn 2. And then what will you be telling your wife? And I used to do like 10 times a day that time. Does she want to hear that? She's not interested. Except you don't want to get married. So you can enjoy yourself now and then be celibate later in life. Fine. You can go and settle in the seminary. Let's put that you want to become a reverend father.
Right.
But then you're 24, 25, 26. Your life is happening on a fast lane. You can do 3 girls in a day. Kudos. And then you use all those things to keep yourself and give you energy. Kudos. But remember, if you want to settle down, that is when you actually need that thing. By the time you're getting married, you see all these ones you are doing now, you're just doing a sport. You can have sex 20 times a day. That is sport. That is what? Penile exercise. By the time you are married, that is when you will understand that those things are part of marriage. They are marriage ritual that must be done from time to time to keep that marriage going. If you think that is a lie, ask your parents. They'll tell you. So
Awesome
you need
stuff.
to protect your future now. Don't think that you are enjoying now. You are damaging your future. Be careful.
Awesome stuff, Doc. Let's talk about some of the natural solutions.
Little research after this. I'll give you a feedback.
I tried.
I want to know. Yeah. I've heard about that tiger nut. I've heard about those things. And then, fine. But one thing I know is that most of these fruits, they improve sperm quality. That's one thing I know. They improve sperm quality. The green banana, the long green banana,
Yes.
the wine-colored apple, and the lettuce leaves, I know they improve sperm quality. But in terms of erection, I don't know if they do that of erection. I know they improve sperm quality. But you know these things they are interwoven and interrelated. If they by default increase production of testosterone, then definitely they will improve sexual performance in a man.
That makes a lot of sense. So for men who are, currently dealing with this, because you've mentioned quite the solution. It's not a death sentence. It's not something that cannot be corrected, and probably they've heard things on social media that informed them that it's a lifelong disease that they would not recover from. What would you say to these men, because they would have lost confidence and self-esteem to even indulge in sexual activities?
Yes. Part of the disease entity is reduction in sexual desire. Now, if you have been noticing all this, the wrongest place to get information from is the social media. For the first time yesterday, Twitter was silent. Yes, Twitter was silent yesterday night, and that's because of obvious reasons. Our beloved Super Eagles couldn't just deliver, unfortunately. And people people started throwing tantrums as to how they've been playing nonsense from the beginning. I beg to differ, but then that's not what we're talking about. The wrongest place to get information is the social media, be it Twitter, be it Instagram, or whatever thread, whatever you deal with. It is not the right place. The best place to get information is the hospital. That is if you know the worth of your doctor. But let me just give you a hint. Doctors know plenty again. No? So if you know that your sexual life is important to you, get up now and go see the doctor before you hear that he is out of the country. No regulation will stop them all. They will leave. And for obvious reasons, they will. So get up now, go speak with your doctor, get that issue treated. Some people, just by controlling hypertension, sexual life improves. Just by treating diabetes, sexual life improves. So why not get to the hospital, get yourself checked, know this thing? Some people are running around looking for a problem for their sexual desire, not knowing that there's a background medical condition causing it. So when the proper diagnosis is done, life for you starts improving, even without you taking anything to increase or improve the sexual aspect. So I think the best place to go, or I know that the best place to go, is to speak with your family doctor, not just any other doctor, your family doctor. Thank you.
Thank you very much, Doc. We have quite a couple of questions this morning. This one says, good morning to you, Doc. Thank you for such an educative subject this morning. My question is regarding sperm production. When you don't produce a lot of sperm during and after sexual intercourse, does it mean that I have erectile dysfunction?
Okay. Thank you very much. It doesn't mean you have erectile dysfunction. Now, times of sex